voice and speech disorders. So among them, the points of focus are voice and speech, classification of voice and speech disorders, a term called as dysphonia plica ventricularis, also called as ventricular dysphonia, functional aphonia, popularly known as hysterical aphonia, puberphonia, mutational falsetto voice, phonosthenia, glottic insufficiency, muscle tension, dysphonia, vocal cord scars or sulcus vocalis, hyponasality, rhinolelia clausa, hypernasality, rhinolelia aperta, spasmodic dysphonia, vocal tremor, stuttering, and myoclonus. So, speech is an audible communication and consists of phonation, resonance, and articulation. Phonation, expired air and pressure induce vocal folds, vibrations. Factors affecting phonation include appropriate approximation of the vocal folds. Too tight closure of the vocal cord needs excessive expiratory force and makes the voice. It may be strained, harsh, complete aphonia. Too far apart vocal cord needs increased expiratory airflow volume and voice becomes weaker. They are heard as whisper and breathier. The three-dimensional shape of the vocal folds includes atrophy of the vocal folds, may lead on to the concavity in the axial planes, results in incomplete glottic closures. Concavity in the coronal planes results in convergent airflow tract disorders. Length and tension of the vocal cords. The control of length and tension facilitates normal inflections in pitch and tone, and lack of control may make the voice flat and expressionless. Lack of voice inflection, distorted by uncontrolled pitch breaks. Suppleness of the vocal fold, so it provides free vibrations. So what is resonance? The resonance modifies phonation and produces voice. Unmodified phonated sound and vocal folds is strident and unpleasant noise. The principles of modification consist of selective amplification and dampening of component frequencies. They are used in speech therapy. Factors affecting vocal resonance include resonance of head, neck, and chest, motor activity of the pharynx and oral cavity. Causes they include amyotrophic lateral sclerosis, stroke, Guillain-Barré syndromes. Articulation. Articulation shapes the voice into words with the help of lips, tongues, palate, pharynx, and larynx. The impaired motor output, weakness, palsy or incoordination, cognitive or language defects may cause dysarthria. Classification of voice and speech disorders. Classification of voice and speech disorders. So disorders of speech. Dysphasia or aphasia. Impaired comprehension or production of speech due to a lesion of dominant cerebral hemisphere. Receptive dysphasia. Impairment in comprehension of words. Patient appears unaware of the deficit. Lesion lies in the auditory and or visual association areas of the cerebral cortex. Auditory aphasia. Word deafness. Though hearing is normal, patient cannot comprehend spoken words. Spontaneous speech, reading and writing are normal. Visual aphasia or word text blindness or alexia. The vision is normal, patient is unable to comprehend meaning of the written word. Jargon aphasia or agrammatism. Severe sensory aphasia and speech are incomprehensible. So expressive dysphasia or Broca's aphasia includes conductive aphasia, nominal or amnestic aphasia, mixed or global total aphasia. Dysarthria. Disturbance of articulation due to faulty working of the lips, tongue, palate, pharynx and larynx, may be because of a supranuclear, extrapyramidal lesions, cerebellar lesions, nuclear, infranuclear or muscle lesions. Disorders of voice may be dysphonia, aphonia, diplophonia, puberphonia, phonosthenia, Disorder of resonance like rhinolalia, aperta, and glossa. Hyperfunctional disorders include stammering, spasmodic dysphonia, tremors, tic disorders, myoclones. Stridor, it is noisy, high pitch respiration due to turbulent airflow that is caused by upper airway obstruction. Hoarseness, any change in voice quality to harsh, rough, or raspy voice to weak voice is usually referred as hoarseness. Dysphonia plica ventricularis, called as ventricular dysphonia. Dysphonia plica ventricularis, ventricular dysphonia. In this condition, ventricular folds, false cords, take over the functions of the true cords. Etiology, secondary, in case of impaired functions of the true cord, paralysis, fixed surgical excision, or tumors. Ventricle bands try to compensate phonatory functions of the true cords. Functional psychogenic. Clinical features: voice rough, low pitched, and unpleasant voice. In functional cases, in beginning, the voice is normal but becomes rough later when the false cords take over the functions of the cords. So laryngoscopy, you can see partially or incomplete on phonation and obscure the view of the cords. Treatment is ventricular dysphonia is very difficult to treat. Functional type, voice therapy and psychological counseling should be given. Functional aphonia, the functional disorder is usually seen in emotional labile young females. Sudden onset aphonia is not associated with other laryngeal symptoms. Patient is usually able to whisper. Laryngoscopy, vocal cords remain in the abducted position and fail to detect phonation. The adduction of the vocal cords occurs on coughing, and sound of cough is normal. Reassurance and psychotherapy. Puberphenia, matutinal falsetto voice. Failure in the change of childhood high-pitched voice to low-pitched male voice after puberty in boys is usually called as puberphenia. However, the boy's physical and sexual development is normal. The boys are emotionally immature, feel insecure, and show excessive fixation to the mother or sister. Psychologically, these boys try to avoid male responsibilities. Treatment: speech therapy or psychotherapy. Kutzman's pressure test. In this maneuver, the thyroid prominence is pressed in a backward or the downward direction. It relaxes the overstretched cords and low tone voice is produced. In this way, boy can learn to produce low tone voice and trains himself to produce syllables, words, and sentences. Prognosis is usually good. Phonosthenia. This is fatigue of the phonatory muscles, especially thyroretinoid and interretinoid, and results in weakness of voice. Risk factor: abuse or misuse of voice or laryngitis, especially clinical features: easy fatigability of voice. Ideal shows an elliptical space between the cords, triangular gap near the posterior commissure, keyhole appearance of the glottis. Voice rest and vocal hygiene is the treatment. Periods of voice rest of excessive use of voice. Glottic insufficiency. It is inappropriate escape of air during phonation due to incomplete closure of pattern of glottis. Causes: vocal cord lesions, atrophy, scar, paresis or palsy, sulcus succalis. Vocal cord epithelium is scarred to vocal ligament. Diagnosis: video laryngoscopy. So, should give voice therapy and injection augmentation can help, or a definitive treatment called medialization laryngoplasty using cortex grafting. Muscle tension dysphonia. So it is common type of functional voice disorder. Excessive tension in the extrinsic laryngeal muscles affect intrinsic laryngeal muscles and vocal cord mucosa and leads onto abnormality in phonatory process. The supraglottic larynx becomes hyperfunctional for attempting to compensate for GI. MTD has two types: primary MTD, secondary MTD. Endoscopic supraglottic findings: MTD type 1, 2, 3, 4. Differential diagnosis is spasmodic dysphonia, vocal cord scars or sulcus vocalis. Etiology is not certain. You can see irreversible loss of viscoelasticity in the laryngeal space leads to formation of scar or sulcus vocalis. There are three types: superficial sulcus with moderate dysphonia with severe dysphonia. Treatment is injection, augmentation, or permanent implant guidance. Hyponasality, rhinolilia crassa. So, etiology is rhinosinusitis, buckage of the nasopharynx results in lack of nasal resonance, MNing sounds, allergy and non-allergic rhinitis, nasal masses such as polyps and tumors, nasopharyngeal masses and adenoids, familiar or habitual speech patterns are seen. And other causes: deviated nasal septum, coronal atresia, and terminate hypertrophy. Hypernasality, rhinolilia aperta. So the failure of nasopharynx to cut off from the oropharynx or undue passage between the oral and nasal cavities results in nasal resonance of all words. Velopharyngeal insufficiency, etiology: short palate, cleft palate, paralysis of palate, palatal perforation, palatal large nasopharynx, oronasal fistula. Treatment is: so treatment of the cause, voice therapy helps in some conditions. Spasmodic dysphonia, symptoms are spastic dysphonia, spastic aphonia, phonic laryngeal spasm, and coordinated laryngeal spasms. Types: adductor, abductor, mixed types. So clinical features: usually normal vocal cords, but the functions of abnormality in speaking, reduced loudness of voice, vocal tremors, similar to essential tremor, decreased speech intelligibility. Symptoms worsen when the patient is under stress or telephone. Stuttering is neurological moment disorders in which the abnormal, involuntary, and inappropriate use of speech muscles results in disfluency. Myoclonus is a disease of central nervous system. It consists of sudden, brief, shock-like involuntary movements which are caused by either muscular contractions or inhibition